Hello and welcome to another edition of the Lynn Lowdown, and we have another returning guest. Miss Audrey is here with us. Last time she was here, we was talking about health insurance premiums and changes, and I'm about to do it again because there's some changes happening with the health insurance that residents need to know. So how are you doing?
I'm doing great. Thank you so much for having me on. I really enjoyed our last conversation, so it's great to be back. And I do have good news about health insurance premiums, so it's especially great to be back.
It is definitely always good to hear that there's good news coming around with the year, with a lot of bad news from the past year. But before we get into all that, can you just talk about the past year and how it's been for you all?
Yeah, absolutely. So I work at the Massachusetts Health Connector, which is our state's health insurance exchange or marketplace. So that means it's a place where anybody in the state, any resident in the state who doesn't already get health coverage through their job or through Medicaid or Medicare can come and get health coverage. And we're the only place that people can get help paying for it. Through subsidies and special programs that we run to help make health coverage more affordable for people. And so we cover about 300,000 Massachusetts residents and growing. We've been around for about 15 years. But I will say, to your question, the last year was definitely very unique. This was obviously such a challenging year for people all across Massachusetts and across the country, with so many changes and challenges on the healthcare front in terms of the COVID pandemic and all the economic changes that came with that. A lot of people, of course, losing their job, losing their income, going through all kinds of changes on that front. And for a lot of people, losing their job meant losing health coverage too.
Mhm.
So we were doing a lot of work to try to get the word out to people about if that happened to them, what to do, how to come to the Health Connector, make sure they're getting covered, make sure people know about how affordable we make it for people to get covered through the Health Connector. So there's a lot of work on that front, and obviously made harder by the fact that we couldn't do the normal things we usually do to get the word out. Normally, we love to be across communities, across all of Massachusetts, and working with local organizations and local volunteers and small businesses and others, and really kind of being on the ground out there spreading the word. So we, obviously had to adapt like everybody else did over the last year, having conversations like this and spreading the word in different ways. So we've been happy. We've been able to get a lot of people into coverage and make sure that people are able to navigate those transitions. We still worry there's a lot of people out there who don't have health coverage and frankly might not have had it before the pandemic.
Mhm.
But if anything over the last year has been, I think, particularly striking, it's just how vital from a health perspective and a financial security perspective having health insurance is for people.
Yeah.
So we're still at it, and we'll get into the changes that are going on, but the last year has been a whirlwind, but we've been fortunate to be able to find new ways to connect with people to make sure they know about how affordable and accessible health coverage is here in Massachusetts through the
Yeah.
health sector.
Yeah, and with the health connected, there's so much work that's done in communities where people that don't particularly have health insurance or ever had health insurance or could afford to make the type of salary or what income that could afford them to have health insurance. The Mass Health Connector really just makes it very affordable for people in communities that don't have the access to get health insurance from employer and all that.
That's exactly right. And that's really what the Health Connector and exchanges like it, the Affordable Care Act, Obamacare, took what we had done in Massachusetts and really made it the national model. But that was exactly the idea, was that there are populations of people that just don't get as much health coverage through their job as others. They tend to be Black communities, Hispanic communities, and people like that were getting left behind in terms of
Mhm.
health insurance coverage. So the work we do is really intended to try to bridge those divides and make sure people can get into good coverage
Mhm.
that's there for them when they need it and is affordable. And we're really proud we have so many options for people that people can qualify for $0 plans, very low dollar plans. And we've done that using Affordable Care Act subsidies as well as state subsidies kind of wrapped around it to bring
Mhm.
as many people as possible into coverage.
Yeah, I'll be the first to say I did have it before I got a full time job. I was on the Mass Health Connected, so it was very beneficial when I when I didn't have a full time
That's
job. But
great. We have a
yeah,
happy customer right here.
yeah, definitely. All right, now, so can you just talk about some of the changes that are being made and some of the new additions to the Health Connector policies?
Yes. So as people know, we've had the Affordable Care Act for the last 11 years in the country, and that has helped make health coverage more affordable to more people over that time. And Massachusetts kind of adds extra subsidies to help make coverage even more affordable for people. But something really big happened last month, which was the American Rescue Plan, which was sort of the big COVID relief bill that President Biden and Congress worked on and signed into law last month. People may have heard on the news all kinds of things about that bill and all the things that were in it, like stimulus checks and help on childcare and other conversations like that. But included inside of that bill is the most dramatic expansion of health coverage affordability since the passage of the Affordable Care Act back in 2010. And so what the bill does is really make more people eligible, more people can qualify for paying for health coverage than ever before. So people who've already been getting financial assistance through exchanges like the Health Connector will now get more of it. So right here in Massachusetts, that means for people who already are enrolled in our special Connector Care program, are going to, about 2/3 of people in that program will see lower premiums starting in the next month. And then in addition to that, people who've never qualified for help paying for health coverage before because they earned a little bit too much, those people can now newly qualify for savings on their health insurance premiums. And so altogether, it's hundreds of millions of federal dollars coming into Massachusetts to help make people's health insurance premiums lower. So we are working like crazy right now trying to get the word out to people. For people who already get subsidies through the connector, we will automatically do this for people. They don't need to take an action. We'll kind of automatically check and make sure they're getting the best deal possible. So many people may see lower premiums right off the bat. But people who aren't covered through us, who are in a coverage gap, who are uninsured, people who maybe buy their own health insurance directly from an insurance company, those people need to come to the Health Connector's website and find out about the new savings opportunities, because they will need to, submit a new application requesting financial assistance in order for them to get in. But more people than ever before will qualify for low or $0 health coverage through the Health Connector as a result of the American Rescue Plan.
And the process is fairly easy for people to fill out the information that they need to, and then get approved or not about the health insurance, correct?
That's right. So people should come to the Health Connector's website, which is mahealthconnector.org. And they can come there. Right when they get there, they'll see a pop-up that says, learn more about the American Rescue Plan and the new savings available to you. So people can click on that. They can see information all about it, answer any questions. But then people can actually just go ahead and fill out an application if they've never done that before and they need to get into coverage. So it walks you right through it. There's all kinds of supports on the website to answer questions people have. People are free to call us, to call our call center if they have questions. We also work with special organizations across Massachusetts called navigators. And those are community-based organizations that are specifically trained to help people in communities with getting enrolled in Health Connector coverage specifically, handling the application, figuring out anything they need to do to cross the line into enrollment. And we've got a navigator right in Lynn. The Lynn Community Health Center is a navigator. So people can give them a call, go see them, and they're trained and resourced to help people get into Health Connector coverage and answer any questions they might have about the process.
The navigators, that's the one that, that's when you guys had that big event when you were actually walking around in the community, getting people signed up, correct?
That's right, exactly. So we're so happy. They're a wonderful partner. They're a wonderful navigator, and exactly, yes, back before COVID, and again, we can't wait to be out there in the community working with our navigators and walking around, talking to people, helping make sure people know how to get covered.
How important are those, places like the Lynn Community Health Center? Can you just talk about how important they are in connection with what you guys do?
Oh, I can't overstate it. The navigators we work with, like Lynn Community Health Center, are vital to what we do. I mean, we can do all the kind of big picture marketing and messaging in the world, trying to talk to 6 million people in the state about health coverage, how important it is, what to do. But there's something that is so invaluable that we can't replicate, that comes with local organizations on the ground that know their communities. They've got staff that speak the languages spoken in their communities. They know these people. They know, this is where people get their health care. So it's convenient to people who maybe don't have coverage, but you have a healthcare need and they can come in and get that taken care of and get covered at the same time. So there's an expertise and a familiarity with the community that navigators are able to deliver for us in ways that people like me just can't, as hard as we may try. So we just feel really indebted to organizations like Navigators for what they do. They help us spread the word every year for open enrollment. They get the word out in their communities with their constituencies. They help us do cool creative messaging, and they help us learn about the communities that they serve so that we can then translate that into the policies and programs that we run at a state level. So we're so glad to have their partnership, and Lynn Community Health Center in particular is just really a crown jewel.
Yeah. Now, now for the this enrollment phase or additional phase, this is going on to like till next month. Am I correct?
So originally it was just going to be through this spring, but we actually recently made an announcement that we'll be running this extended enrollment period all the way through July 23rd. And that's because it's really over the course of the next couple of months that we're rolling out these new savings opportunities for Massachusetts residents. So right now, it's early April. Throughout the course of this month, people already covered with the Health Connector who are getting financial assistance already, we'll be contacting people saying if their premium is going to go down. We'll be contacting people to say your premium may go down, but we need you to take this action and submit this new application, or whatever the steps may be. And then there's going to be broader work we're doing over the next 2 months, and into May, when the new savings for people who earn a bit more money and who previously earned too much to qualify for savings, we'll be rolling those out. So we thought between all of those different factors and kind of new savings opportunities for new types of people, we wanted to make sure people in Massachusetts had extra time to really understand it and to take the actions they need to come take advantage of the new savings through the Health Connector. So that being said, we're running enrollment through July 23rd, but that said, people should not delay. Please don't put it off until July. It's so important for people to have health coverage. COVID, even aside from COVID, I think the last year has just taught us so much about it's so important for people to have, affordable, easy access to all the healthcare you could need. For health conditions, for unexpected developments, just in terms of protection for your own health and financial security.
Yeah.
So for people, taking a look at their options, it's important for people to know they need to come in, shop, select a plan, make a payment if they owe one by the 23rd of any given month during this period. And then the first of the following month, their coverage will kick in. So for example, if you come and sign up for a plan on April 18th this month, you make your payment, you're good for May 1st coverage and you're all set. You don't have to worry about it anymore. So that's why we want people to come in early, take action, and make sure they're taking advantage of all this new federal money coming in to Massachusetts to help make health coverage more affordable.
Definitely. And lastly, I just want your thoughts on this. With the vaccine, we got the COVID vaccine out right now. And it's free. In most cases, it's free everywhere, but probably it's gonna start costing at some point. Just how things go. If that happens, will the Health Connector be ensure that people are covered for that to receive the vaccine if it gets to that point? I don't know if it is or isn't, but just a hypothetical scenario right now, if that would happen.
It's a great question. I'm sure people worry about that. So people should know the COVID vaccine is free, whether you have health insurance or not. But if you have coverage through the Health Connector, it will be covered through your Health Connector coverage. And one of the great things about exchanges like the Health Connector is people can know that the coverage they're getting through us is legit, vetted coverage that meets all of the state standards, that meets all of the Affordable Care Act standards. And one of the things the Affordable Care Act did was say that vaccines need to be covered by plans offered through exchanges. So people should not worry about the COVID vaccine or other important preventative vaccines ending up costing them money down the road. So that's one of the benefits, is the peace of mind that comes with having this kind of health coverage. There's no fine print people need to worry about. We do all that work for people in terms of making sure everything offered is going to be there for you when you need it. So people should not hesitate about that.
All right, definitely. All right, just one more time, please let them know all the vital information, the website to go, the dates, the important deadline dates, all that good stuff.
Yes, absolutely. So the Health Connector is rolling out new savings opportunities for Massachusetts residents over the next couple of months that are being made possible as a result of the American Rescue Plan, the new law that was passed by Congress and signed by President Biden last month. So hundreds of millions of federal dollars are coming into Massachusetts right now that will lower premiums for, we believe, hundreds of thousands of Massachusetts residents. People who are not already covered through the Health Connector should come learn about the new savings opportunities, get covered. There's never been a better time for people to get covered. There's never been this many savings opportunities for Massachusetts residents to afford their health coverage. More people than ever before will qualify for $0 or low dollar health coverage through the Health Connector. We're running an enrollment period all the way through July 23rd. So people can come in at any point during that time between now and July 23rd. They don't need a qualifying event or anything else like that. If you don't already have coverage through your job or in some other way, come on in, go to the Health Connector's website, mahealthconnector.org. If you need information about the new American Rescue Plan savings, we've got all of it on our website. We have a special URL there and frequently asked questions and all the like. If you need help in your local community, learning more about the American Rescue Plan savings and how to get covered through the Health Connector, Lynn Community Health Center is one of our navigators. They do wonderful work in the Lynn community, helping get people covered, answering questions, providing assistance. So we certainly encourage people to reach out to them if they're looking for help in their local community. And we know there's lots of people in Massachusetts, even though we have the country's highest rate of health insurance coverage right here in Massachusetts, there's too many people that don't have health coverage. And if we've learned anything over the last year, it's how important it is to make sure that every resident, every population has equal, fair, affordable access to health coverage. So people should come to mahealthconnector.org to get covered.
All right, Audrey, once again, thank you for all that information, and thank you for coming on once again to give us all this information. We really appreciate it.
Oh, my pleasure. Thank you so much for having me.
No, not a problem. You guys have been watching the Lynn Lowdown. Have a great day, ladies and gentlemen.